What you need to know about intracranial pressure. So ICP is the pressure inside the skull, which includes blood, brain, and cerebrospinal fluid. It's a very critical parameter to determine neurological ailments and brain health. Very important to maintain the normal range. The range lies between 7 to 15. If it's more than 15, it indicates neurological complications or even brain death. So next we'll discuss about the causative factors. There are certain causes which are responsible to raise up ICP in the brain. So the first one is inflammation. More inflammation, more pressure. And the second is brain tumor. Brain tumor cause obstruction in the homeostatic environment in the brain. And the third one is intracranial hemorrhage. So intracranial hemorrhage build up more pressure inside the brain and cause obstruction in the CSF flow. When the CSF is facing trouble to freely move inside the brain, it also build up more pressure. Last but not the least, CSF production. So abnormal CSF production also build up pressure inside the skull. Followed by the clinical manifestations of increased ICP. Clinical manifestations are divided into three parts: early manifestations, moderate manifestations, and the late, we can also say deadly manifestations. Early manifestations considers cerebral hypoxia. When more pressure inside the brain, it compresses the blood vessels. So once it compresses the blood vessels, it's known as cerebral hypoxia. When the patient experiences cerebral hypoxia, it includes altered level of consciousness and change in mental status. Moderate manifestation comprises constant headache, and the patient also experiences vomiting without nausea. Very important to remember, vomiting known as emesis without nausea. Late signs of clinical manifestations, also known as deadly signs. So the first one is irregular respiration, known as Chinese Stokes respiration, and the second one is nuchal rigidity, stiff neck. The patient experiences stiff neck, so do not move the neck of the patient. Very important to remember in the nursing consideration. Last but not the least, brain herniation. More pressure compresses the brain stem downward, so it causes brain herniation, dilated and fixed pupil. It's also the most important sign in the raised ICP. As we know, there are 12 cranial nerves. So ਕਿਹੜੀਆਂ cranial nerves involved ਕਰਦੀਆਂ ਨੇ increase ਕਰਨ ਦੇ ਲਈ ICP? So the cranial nerve number 6 abducent, cranial nerve number 4 trochlear, cranial nerve number 3 oculomotor. Nursing interventions for increased ICP includes, the first one is raise the head end of the patient 30 to 40 degrees recommended, and the second one is do not move the neck of the patient due to nuchal rigidity. Third one is maintain the normal body temperature just to provide comfort to the patient. Next is reorient the patient. It's very important, reorientation. Last, gentle and steady movement is recommended. Medical management of increased ICP. Medical management depend करती है साडे cause पे. What's the basic cause of rising the ICP? If the increased ICP occurs due to brain tumor, so surgical treatment is the best option. So second, if it's occur due to edema or inflammation, then diuretics and corticosteroids are the best option. So in the diuretics, ਅਸੀਂ ਕਿਹੜਾ diuretic use ਕਰਦੇ ਹਾਂ? Mannitol. Mannitol is the most commonly used diuretic to lower down the intracranial pressure. To lower down the cerebral metabolism or to slow down the cerebral metabolism, we do use barbiturates. So for example, thiopental and phenobarbital. Stay tuned for more such informative videos. Join Global Education NCLEX-RN Academy for best NCLEX-RN preparatory classes.